So I'm Professor Dr. Sampoornam from the Department of Mental Health Nursing from India. So I'm here to present an interesting paper on gadget-linked virtual autism. So I think many of you would have come across the term autism spectrum disorder, autism. But the term virtual autism is little new to all. So we are here to discuss about the same. So in introduction, exposure to gadgets may cause virtual autism among children. Virtual autism is a term coined by Romanian clinical psychologist, and this is when a child exhibits autism-like symptoms due to screen time around 4 to 5 hours a day. So most of the children nowadays, they sit in front of the screen. They love all gadgets like tab. Of course, it could be even a simple screen or TV, even a mobile phone, Android phone, Apple phone, quite common. Even they would have crossed 7 hours, 8 hours. In clinical picture, we see even 22 hours a day children. Virtual autism doesn't mean the child is autistic. It means the child will show autism-like symptoms. So classic autism in the sense like autism spectrum disorder is a neurodevelopmental disorder and it can be, ma'am, next slide, next slide, ma'am. Yeah. And it can be present since birth. There can be several other causes behind it to aggravate in the long run. So basically, autism spectrum disorder, it is purely a neural developmental disorder, as you all know. And a few scientists, they suggest that it is because of allopregnone, which crosses the placental barrier during the intrauterine period. But in case of virtual autism, a normal child can develop and it can turn to be autistic because of screen. Next slide, ma'am. Gadgets or electrical or mechanical device that people use frequently in their daily lives. It could be a mobile phone, tablet. It is observed that young children who spend too much time with e-gadgets like iPad, tablet, and mobile have autism symptoms. Next slide. But when parents completely take away the digital screens for a few months or few days, the virtual autistic child behavior can improve and symptoms of autism can disappear even. So the simple phenomena is simply called as virtual autism. Some studies suggest that increased screen time is associated with even melanopsin expressing neurons and decreasing gamma aminobutyric acid or GABA neurotransmitter, and thus it results in aberrant behavior changes and decreased cognition and language development. And cognition in the sense here is nothing but like attention, concentration, memory, intelligence, abstract thinking, judgment, even concrete thinking. In case of language development, see if a normal child could speak and he could learn some language, it is simply called as linguistic area in the brain. It could be like as Dr. Lu said, it can be like Wernicke's area, Arcuate area, Broca's area in the brain. And here all these areas affected because of the screen show for a long time, more than 4 to 5 hours per day. Next slide. Here, there are some of the negative health outcomes. Studies have demonstrated that increased screen time in youth children and young children is associated with negative health outcomes such as decreased cognitive ability. Just now I pronounced cognitive ability in the sense it could be like attention, concentration, memory, intelligence, abstract, etc., etc. So impaired language development and delayed even speech development and even mood swings. It could be like extreme pole. One pole could be like even depression, irritability, and one pole could be like mania. All these, and even in clinical picture every day we see clients. Next slide. Even difficulty in social interaction and effect on intelligence and even hyperactivity. It is also associated with the visual autism and very short attention span and irritability and endurance even in growth and a delay in development milestones such as grasping, cutting, coloring, a delay in forming emotional bonds, stress and depression is quite common. In clinical picture, we see even all the gross motor, fine motor delay development. Gross motor could be like all walking, even walking sense. You just imagine a child who was crossed 5 years couldn't walk because of long-term screen exposure. So like gross motor and fine motor could be like all the 10 fingers which workouts in grasping, cutting, coloring, etc. It is also distorted. And forming emotional bond is very difficult for that particular children, and even stress and depression is quite common. Next slide, ma'am. So according to a childhood education specialist, parents can allow their children to use gadgets only up to 1 hour per day for children aged 1 to 3. So 1 to 3 age children can use gadgets not more than 1 hour. So 1 hour itself could be a long term, I suppose. I suggest half an hour ideal. Maximum of 2 hours per day for those aged 4 to 7. And the symptom of visual autism often disappears when the child stop all screen exposure and switch to face contact or face to face confrontation, reading, playing with caregivers, other children, and non electronic toys. Yes. Next slide. The child psychiatrist they recommend parents to take them away from screens for a while. So we insist, we reinforce parents and of course the children with visual autism not to take back the screen for a long time and to avoid the screen and to just what to say, just to divert their mind and make their children busy in other activities like going outside more and engaging in outdoor activities, reading books which are very interesting, and get together and talking face to face and simply playing. A child psychiatrist wanted affected children to engage autistic children in more day-to-day social interactions, and they terribly recommend for social interaction. Smile at people, talk to people, rather than chatting with all gadgets. So doctor suggested that parents must provide more chances for socialization to their autistic children, in the sense virtual autistic children. Next slide. So as you all know, as human being, we are all like social animal, and it can be treated. Virtual autism can be treated very easily and significantly as per research. So first step can be like minimizing the screen time, decreasing the screen time, allows a child to invest his focus into other sorts of creative activities. It helps in sharpening other skills like even their life skill, social skill, even their soft skill or higher mental functions, etc., etc. And even positive reinforcement and try to offer small rewards to the kid upon good behavior, like stoppage of long-term screen. It could be a positive reinforcement. We can make a chart, behavior chart, like Monday to Sunday, and if the child is using less than 1 hour, you can make stars. At the end of the week, you can give some token economy, and it could be a very big positive reinforcement. You can take to a ride, or you can present something which could really literally help the child. And number three could be engross him in other activities. Let the child play the sports which he or she likes the most. Next slide. So there are certain diets for even virtual autism. So the problem here is with the addicted brain, right? Because of dopamine, serotonin, GABA, and melanopsin. So to boost all these area to just calm down the symptoms, we add some of the diet for virtual autism. So number one could be nuts. It's no wonder. So while reading literatures, I was just wondering, almonds, walnut, and cashew nut, peanuts, and hazelnuts are very rich in vitamin E, and it helps in boosting memory. So automatically, if a child is addicted to screen or he has developed some virtual autism, these nuts could really help them out in boosting memory. And they're also antioxidant which protect against cell damage or the nerve damage. And walnuts are rich in omega-3 fatty acid, and they are valuable a substance for brain function, memory, and thinking abilities. This fatty acid also encourages cognitive functions and helps out with speech that fosters overall development. So this omega-3 fatty acid, in nutshell, omega-3 fatty acid really does that too good for mental health and power. Next slide. Second point in diet could be seed. So it's no wonder pumpkin seeds are very, very good, and it is very rich in magnesium, copper, and even zinc. It increases the concentration, memory, and attention span of the virtual autistic child, and one of the easiest to feed a brain boosting food for kids also. So this pumpkin seeds, I've done many research on this pumpkin seed, and some couple of conference back, I spoke about this pumpkin seed also. This pumpkin seed is very good for dementia clients. It suits for dementia clients as it contains omega-3 fatty acid, of course, and it even boosts the memory. As such, like dementia patients, even in autistic patient also, like virtual autism children also can take the seeds so that they can have good memory power. Next slide. So number three is cocoa powder. So this cocoa powder, pure cocoa powder, it contains brain boosting components as it is packed with large number of antioxidant molecules. The main is epicatechin, helpful to improve cognition and speech impairment in studies. Many studies have proved the same statement. Hence, cocoa powder is also an important brain development food for children. See, this cocoa powder is basically even present in dark chocolates. So, what do I recommend as a scientist or nurse scientist? Kindly, you can recommend all the virtual autistic children to take dark chocolates. Again, it boosts the memory power and it keeps the brain fit. Next slide. Yeah, number four is Ashwagandha. Ashwagandha is an adapt adaptogen. So it is also known to reduce anxiety and stress symptoms. Moreover, it increases acetylcholine levels, which supports better memory, mental focus, and intelligence. So ashwagandha also improves communication between nerve cells and stimulates the body capacity to heal any nervous system damage. It also helps in speech improvement. So something I would like to add here is, along with ashwagandha powder, even speech therapy nowadays we don't seek for speech therapist because due to shortage of speech therapist, nowadays we recommend robotic speech therapy. Even robots can perform, or it can be a very good speech therapist more than a real speech therapist. So here robo itself could teach what is eye contact and how to spell and syllabify a word, a paragraph, sentence, or to make sentence, or to go on with all speech. It even touches the point and all the area for children. So nowadays we recommend, autistic children also we recommend robotic speech therapy along with Ashwaganta. Next slide. Some of the practical suggestions are here for you people. So you can educate families about screen effects and case studies and the potential combination link causation of screen time and parent-child interaction. So all these are the teaching points we should reinforce the time of counseling or any other what to say like meet face-to-face meet and all. We reinforce parent-child interaction, parenting style. We reinforce, and of course, screen effects. We reinforce. See, like a couple of weeks back, also I received a client. She was just 19 years old girl. She was on screen for more than 24 hours. So you just imagine, per day we do have only 24 hours. So more than 24 hours in the sense, you just imagine how far she's addicted to that screen. So her parents was literally with tears. So we treated her. We gave some suggestions. We gave drugs. We have put her under drugs, and we have suggested for next review also. So it can assess parents and children's screen time with the questionnaire even. So nowadays questionnaires are available so that we can make how far they're addicted and how far they've developed virtual autistic symptoms. So consider parent-child routine, even roles, culture, occupation, etc., etc. All these could be a very practical suggestion point. And you can help devise a plan to replace or limit screen time with play and a role, social interaction. So we suggest for play, natural play, play with peer group, and even social interaction. Socialization is must. We just we just install this in the brain of that particular end children. So use tools like screen time timers to help decrease screen time. So we can make like an alarm so that a screen, if it crosses 1 hour, automatically the alarm will poke you to stop the screen. So that could be one of the method to stop the screen time more. So this could be one of the practical suggestion. Next slide. We can promote joint attention, eye contact, speaking in full sentences, and exposing the child to different environments. It is very important. And eye contact is very important because children, those who see screen for a long time, they don't maintain eye contact with human being, normal human being, because they love screen only, not the human being. So that eye contact we teach. That's why just now I told robotic therapy, robo itself teaches what is eye contact in desired language. The speaking in full sentence is also necessary. We insist the same. And find and use clear outcome measures for autism spectrum disorder symptoms. See, it's just virtual autistic symptom only. If you could stop the screen for a long time, automatically the symptom disappears. We need not worry for autism spectrum disorder symptoms at the initial level. So that you should keep in mind as a therapist. And you can integrate sensory integration and other approaches of integration to promote engagement in play, eatings, schooling, and even socialization. And we can also refer to any MD or speech language pathologist or even robotic speech therapy as appropriate. And you can stay up to date on virtual autism research. So we can just update what is really going on in virtual autism research updates. And if there is any evidence-based practice that can be put in clinical practice also, the algorithms can be practiced in clinical setting also. So it's very natural regarding virtual autism. So I really thank the organizing committee members. And with this, I'm closing the session. Any queries can be put in the chat box. Thank you. Thank you, one and all.